Any questions? Okay.
All right. So, welcome. It's nice to see everybody here. I know it's a gorgeous day, and you had many choices and many options of things to do. And I thank you for coming tonight, and I hope that this will be informative for you. My name is Aita Susi. I used to be a pediatrician, and now I'm a child and adolescent psychiatrist, and I work with families and children in the area of ADHD. So I thought the first thing that we would do is start off with a history of ADHD. Many people seem to believe that it's a recent diagnosis and it really doesn't count because, it's something newfangled and doesn't have a basis in history. Yet, there are examples of ADHD showing up in medicine as early as 1798. There was a Scottish physician by the name of Sir Alexander Crichton, and he talked about people who have the incapacity of attending with a necessary degree of constancy to any one object. Sounds like inattention to me. About 50 years later, Dr. Heinrich Hoffmann he's German, came up with this series of books called Struwwelpeter, or translated into English, Slovenly Peter. And this series of books had characters like Fidgety Phil and Harry who looks in the air. All right, so we have inattention and we have hyperactivity already in children's books. And this guy didn't like cutting his fingernails and doing his hair and, doing boring things like that. Then in the early 1900s, 1902, there was a doctor, a pediatrician by the name of George Still, and that is his true name, who also spoke about inattention and hyperactivity. He described ADHD with specific details, and he's the first one to have really done that, and he's accredited for kind of starting the history of formal ADHD. ADHD became a formal diagnosis in 1968, and then it was called the hyperkinetic reaction of childhood. And the name seems to change every time we come up with a new manual for physicians. Sometimes ADD, sometimes ADHD, sometimes with this, without that, but the general condition involves inattention and hyperactivity. So I guess I should say what the letters stand for, though most of us, I believe, already know. ADHD stands for Attention Deficit Hyperactivity Disorder. It has two basic components, the inattention aspect and the hyperactivity aspect. Some people have both aspects, some people only one or the other. All right. So diagnosis. What you need for an accurate diagnosis of ADHD is 6 criteria in 2 different settings. Okay, so school and home, or school and synagogue or church, because they don't want the behaviors to be dependent on the environment that you're in. Some people get nervous and anxious at school and so have all these kind of hyperactivity behaviors going on, but that doesn't come out at home. And this is a biological condition, so we want it to stay consistent over time. Onset. This is an old criteria, onset before age 7. This is a criteria that's the least used, let's put it this way. Plenty of people get diagnosed with ADHD who have a supposed onset at age 9 or 10, or it kind of first gets discovered as a teen or as an adult. But the formal diagnosis says that the onset should be before age 7. And there also should be evidence of problems in daily living. Meaning, if you just kind of drum your fingers like this and are a little bit hyperactive, but you can do your work, you can sustain your relationships, you can go to school, that's not an illness. Okay, it has to actually interfere with your daily tasks, whatever your tasks are. Well, I already talked about the two varieties. Many, many, many ways to diagnose. A psychologist can diagnose. A pediatrician, a psychiatrist can diagnose. The key part is that you need someone who's experienced in this, and you need to look at the behavior across different settings. That means you need to make phone calls to school teachers, talk with parents, maybe talk with other family members, and get a sense of this child. Because one person's viewpoint invariably is going to be colored by their personal ideas of how a child, quote unquote, should behave. So you want to get a variety of viewpoints. We do this through interviews. We do this through scales. There are things called Connor scales and Vanderbilt scales where you kind of check off things. And then there's this computerized test called a CPT test where the child sits behind a computer and they have to attend to different tasks. And you see how they perform under stress. And lastly, there is a new form of diagnosis called the NEBA system, Neuropsychiatric EEG-based assessment aid. It's one way of diagnosing ADHD where they actually look at your brain waves, sort of like doing an EEG. And there's a certain relationship between the brain waves that is more common in patients with ADHD. There's no one test to diagnose ADHD. I think that's the take-home message. There's no blood test. There's no one criteria, one thing that you look at. You have to look at a variety of things and get a constellation or a picture. Yeah?
You say you need 6 criteria. What are the criteria?
On my way.
Sorry.
That's okay. There we go. Okay, so for the inattentive aspect, you have 9 options. Difficulties with the details, following through, organization, distractions, remembering things, sustained attention, especially sustained attention for things that are not interesting. Listening, problems with losing things, and problems with boring tasks. You need 6 out of these 9 in order to qualify for a diagnosis of the inattentive form of ADHD. For the hyperactive form, you need also 6 out of these 9s, and these are signs of hyperactivity: fidgeting, climbing, excessive talking, interrupting, on the go all the time, difficulties staying in your seat, difficulties playing quietly, difficulties taking turns, and difficulties blurting out answers. These are the type of kids who just are moving, and they can't stand in line. They're going to butt to the front of the line. They want to play with this for 2 minutes, and then the next toy for 3 minutes. And unless they're totally interested in something, they're just moving from one activity to the next. And they're skinny. Frequently, they're just burning off calories, and they tend to be really, really skinny. Okay, so overdiagnosis is, both overdiagnosis and underdiagnosis actually, are a big concern in ADHD. In cases of overdiagnosis, well-meaning family members and even physicians diagnose normal child behavior as illness. And it's a frequent question in psychiatry and psychology: where's the dividing line between what's on the edges of normal and what becomes illness? And sometimes behavioral problems are diagnosed as illnesses. And a key aspect here to note is that other conditions can look like ADHD. For example, anxiety. When a person gets anxious, they may fidget a lot. They may talk fast. They may not be able to sit still. They may be doing all kinds of behaviors that look like ADHD, but it's not a biological thing that's going on. They're just nervous or anxious about something. And so if you don't look carefully at the whole picture or look at the underlying situation, you may overdiagnose anxiety as ADHD. Taking a look at depression, that can be overdiagnosed as the inattentive form. okay? You're tired, you don't feel like doing something, you can't focus, you can't concentrate, you lose things, you can't keep track of what's going on. It'd be very easy to, especially depression in children is very difficult to diagnose. It's hard to diagnose in adults too, but most 9-year-olds don't show up and say, Mommy, I'm feeling sad. Okay, they just kind of either act out, which would be the hyperactive form, or they just kind of get droopy and quiet and can be overdiagnosed as having ADHD. And of course, mania can also look like the hyperactive form of ADHD. Take-home message from this overdiagnosis slide is provider inexperience. You want a provider who works with ADHD and knows to look at all of the aspects. Instead of just saying, oh, your kid's hyperactive, must be ADHD. And then the other problem is underdiagnosis. Well, that's just the way they are. They've always been quiet. They always lose things. We go through, 3 winter hats every winter. That's just my son or daughter. But it may or may not actually be an illness. The inattentive form of ADHD is frequently underdiagnosed because it doesn't catch people's attention. When people are daydreaming and looking out the window, nobody notices. And so they don't receive the workup that's necessary. Also, in households that have a certain amount of mental illness, let's say there's a bipolar parent or a sibling with schizophrenia, there can be chaos in the household and other children receive less attention, and so the diagnosis of ADHD or ADD can simply get missed because of all the chaos that's going on. Obviously, shame is a topic that we talk about a lot here at NAMI, that any mental illness can be equated with shame, and so people don't want to go and seek professional help. And I've already talked about provider and experience. Okay, so multiple diagnoses. Understanding this slide, 49%, about half the people with ADHD only have ADHD. But 11% of people with ADHD also are depressed. So they have 2 diagnoses, ADHD and depression. Another 11% of people with ADHD also have an underlying anxiety disorder. And then there's conduct disorder. Conduct disorder is something we don't see very often, fortunately. It's a pretty serious childhood condition where children don't have a sense of empathy for other kids, and they set fires and they hurt animals and do pretty significant damage to the world. This figure seems a little bit high, but according to these folks, 7% of children with ADHD also have some really inappropriate behavioral issues. What's missing from this slide is, it's what's called oppositional defiant disorder. I don't wanna, and I'm not gonna, is your basic description of oppositional defiant disorder. And many, many kids with ADHD also are oppositional or defiant. Mainly the point with ADHD, and I'm going to go into this more in depth in a little bit, is that people with ADHD love doing what they're interested in. They love it. Playing with trains or cooking or sewing, whatever it is that they're interested in, they want to do it. And that's all they want to do. And when you say, please take out the trash, which is really boring, that's when the I don't want us come out and the oppositional behaviors come out. So, a lot of this you're already familiar with if you have any friends or family members with ADHD. The difficult aspects. They talk a lot, all the time, can't stop. They disturb others, can't sit still. Children will hit each other in class or on the playground because they have so much energy and they don't know what to do with it, and so it just comes out as hitting. Inappropriate comments. Certainly don't listen and lose things, lose pencils, lose homework, lose shoes, lose socks, all kinds of stuff. Certainly homework difficulties. A child with ADD or ADHD can take 3 hours to do a simple homework assignment, and parents are tearing their hair out. And unfortunately, children with ADHD are delayed socially because they're so into what they want to do. For example, let's say playing football, that they don't learn the social cues. They don't learn how to understand how to be in a group setting and take turns. And this becomes an issue for children as well as adults with ADHD. And they love fun. They love that adrenaline kick. And so there's engagement in risky and impulsive behaviors. And there's also a risk of marijuana or alcohol use if the ADHD is untreated. There was a study done in 2003 that looked at medicated children with ADHD, basically teens, and unmedicated teens with ADHD. 75% of those patients who were on medicine for ADHD did not use marijuana or other substances. So the use of stimulant medication is protective against illegal drug use. There's a concern for some parents that if I start my child on a stimulant, that's going to be like a gateway drug to other medicines. And that's definitely not the case. All right. So the next, imagine raising a child who talks a lot, can't sit still. You get phone calls from the school that they're hitting other kids, don't listen, lose their homework, blah, 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 blah. All of that causes problems with the parents. So here's a little breather here. Dennis Amenis had ADHD. So he's at the party and he blows out her birthday candles because he's so impulsive. He tells Mr. Wilson that, you've got to be 100 years old. There's just no minding yourself. If you're thinking it.
Honest.
Oh, they're very honest. Yes. All right. So all of this leads to parental stress. Okay? You get calls from the school about behavioral problems. We've already talked about homework. Everything gets lost. You need to repeat yourself 100 times. With an average child, how many times do you think you have to repeat yourself to get them to put their coat on before leaving the house? What would you guys consider normal or average?
3?
At least 3 times. Yeah, at least 3 times. That's the average child. Now you have a kid who has ADHD. You're talking 6, 8 times. Put your coat on, put your coat on. And if you tell a child with ADHD, get your hat, put your coat on, and get your homework together.
And they won't put your coat on anyway.
No, they won't. No.
So what's the point?
What's the point? And you can't tell a kid with ADHD a 3-step process. You tell them one thing. Put your coat on. Let me see you with your coat on. Oh, Johnny, great, you have your coat on. Now go find your hat and put your hat on. You might get something done. And that's exhausting. Because you want to leave the house, you want to get to work, you have to take the kids to school. Every morning planning this, it's an adventure just getting out of the house. We've already talked about social interactions. It's tough. Kids with ADHD need monitored play dates so they learn how to socialize. It takes time. And all of this, well, what if you have ADD too? What if the parent is really bad? Absolutely. You have a disorganized parent trying to organize a child to get something done.
It's crazy.
It's crazy making, it's exhausting, it's frustrating, and it's a miracle that everybody gets to school and to work on time. And you get extra bonus points if the homework is actually in the backpack. It's hard. So the take-home message is be patient. Be patient. These kids are not doing what they're doing on purpose. They're not waking up in the morning and saying, ooh, how can I make mommy's day miserable? They just are this way, and we as the adults in the environment, we have to kind of calm down and assess and look at the situation as adults and recognize that we just have to work with this calmly. So are there positive aspects? Yeah. ADHD children and adults are really creative. They think, I don't have ADHD. They think in ways that I could never think of thinking. They point out things to me that I would never have seen. It is fabulous being around someone with ADHD. The creativity is enormous. They're darn smart. Whatever they're interested in, they're really, really good at. They're spontaneous. They work very, very quickly because if they're into it, they're doing it. They're good at problem solving because they're out-of-the-box thinkers. I am an in-the-box thinker, and if it's in the box, I'm going to do great with it. If it's outside of the box, I'm the one struggling. They love being outside of the box and problem solving. They're generally happy kids, and there's an emotional sensitivity that goes along with having ADHD. The ADHD children that I work with, they're very sweet. There's a caring, there's an understanding, there's a way of seeing life and being with people that's very, very beautiful. They're sensitive, and they get yelled at a lot. What? You lost your homework again? What? And this actually hurts them emotionally. So frequently kids who are not properly managed with ADHD lose self-esteem because they take things to heart. So, famous people with ADHD. My favorite is Robin Williams, top of the list. I mean, he's fabulous. He can think out of the box all the time. A lot of sports people, Olympic athletes have ADHD. Where would we be without Thomas Edison and his, 1,000 tries to create a light bulb? And then some that Leonardo da Vinci, Galileo, all of these really cool people. I mean, imagine what Salvador Dali's paintings would look like if he didn't have ADHD. I don't think he'd be famous. No. So there's a lot of cool aspects to having ADHD. You just got to learn how to manage it and work with it. So myth versus fact. Myth. ADHD is caused by poor parenting. Not so. It's biological and often genetic. 2 illnesses in psychiatry have the strongest genetic component. ADHD is one of them, and believe it or not, the second one is schizophrenia. Both ADHD and schizophrenia have really strong genetic backgrounds. There's a fear that parents have. If one of my children has ADHD, all of them will have it. Fortunately, that's not the case. It can be the case, but it's not a definite. There's a myth that ADHD is not a disability. Not true. Children with ADHD in school, because of IDEA, and I did memorize this, but I don't remember what it stands for anymore. Individuals with Disabilities Education Act has stated that children with ADHD get specific accommodations at school for test taking and learning. ADHD is a real disability. Medication is the only treatment. No, there are a lot of treatment options, and I'm going to go into some of that. And then kids with ADHD want to behave badly. It's not the case. They don't want to behave badly. They cannot help themselves. And I'm going to explain the biology of it to you in a little bit. All right. So here we go with biology. Here's your brain. What this is, okay, this is where your eyes would be, and this is the back of your head. And so if you were to take my head like this and just slice it in half, please don't do that, but slice it in half like this, you would get a picture of the brain like this. Here's your spinal cord. And this is what I call the bag of worms on the outside. And here's your cerebellum. All right. What's key in ADHD is this area here called the prefrontal cortex. It's right here in the front. And the cingulate gyrus, which is this pink thing going around like this. Let me tell you what the prefrontal cortex does. The prefrontal cortex helps you to look at yourself in a group of people and understand emotions and social context. Prefrontal cortex is the one that helps you decide, oh, I want that now. Should I go out and get it? Or would it be appropriate for me to sit still and not run after the ball that just went into the street? So if you have problems with your prefrontal cortex, you can't make those kinds of decisions. It's like, I want it now, and I want it now, and I'm going to do it, and there's no holding you back. Illness in the prefrontal cortex is called the disinhibition syndrome. Like blowing out the candles on someone else's birthday cake. Yes?
Is that impulse control?
Yes, absolutely. Impulse control. Difficulties with impulse control. Other aspects of the prefrontal cortex have to do with organizing and planning. So if you have a fifth grader that has to do a project on Bolivia, for example, and you have to do your research, put your note cards together, get everything organized, and then do the presentation, you're organizing all of this with your prefrontal cortex. But if this guy doesn't work very well or goes offline, that's how I like to look at it. ADHD kids have they have a normal brain, but parts of it just aren't online yet. It's not engaged. Because, and we know this, because when they're interested in something, when they're interested in, let's say, their latest rock and roll star, they can organize, they can think, they can plan, they can do all of that stuff. The prefrontal cortex comes online when they're interested in something. But when they have to do a homework assignment on Bolivia and they're not interested in something, forget it. It's as if this prefrontal cortex went offline and doesn't exist anymore. Cingulate gyrus here. This area here is about corrections. Going over your homework a second time and making sure that all your addition and subtraction is done correctly and properly. Correcting social behavior. And being motivated. Okay? If your motivation is down, this part, your cingulate gyrus, goes offline. So when you ask your ADHD child to take out the trash, which is really boring, the cingulate gyrus goes offline, the prefrontal cortex goes offline, the rest of the brain is functioning just fine, but the part of you that makes you motivated doesn't want to work, and the part of you that gets you organized doesn't want to work, and there you have ADHD. It's there, the structures exist, but they're offline. So treatment. We want to get the ADHD brain back online. And we do that with medications that stimulate the brain. We're stimulating those two parts of the brain to start to work. We also want to provide modifications that reward and stimulate the brain. Like you take out the trash 3 times when I only ask you once, then you get a star, or you get a little reward, a special time with mommy, daddy, however you want to work that. And we want to teach family members and teachers how to work with an ADHD brain to get the best results. Take-home message, the ADHD brain needs to be stimulated. Once stimulated, it's working great. All right, so the MTA study. This is a very, very famous study that took place in 1999. 14-month study with a lot of kids. Getting 500 children to participate in the study, this is a big deal. They had 4 groups of kids. One group received meds. Another group received behavioral therapy. A third group received a combination of meds and behavioral therapy. And this 4th group was followed, but did not receive any of these treatments. They just did whatever the parents wanted to do, called usual community care. All 4 groups had a reduction of ADHD symptoms. But there was significantly greater improvement in the medication group and in the combination group, with those in the medication group doing a little bit better. So when the study was completed, the take-home message was, medication is the best, give your kids meds, and everything's going to be all right. Then they did a 2-year follow-up at the end of the study. They stopped the study, everybody was sent home, do whatever you want to do, and they recontacted 500 kids, 500 families. It was a lot of work. And what did they find out? Everybody who'd been in the study did better than those who received no treatment at all. But there was no difference in symptoms between any of the groups. Everybody equalized. So then the take-home message became, it doesn't matter what you do, but do something when you treat ADHD. If you want to do meds, do meds. If you want to do family training, do that. It doesn't really matter, but address the issue. What are the risks of not treating? Problems at school, problems with self-esteem, problems with emotions, physical injuries, and higher rates of substance abuse. We've already gone over some of this stuff. Basically, a child who has ADHD who's not treated has less chances of living to their full potential. And that's really a key point. All these kids have a lot of potential. You just want to do what you can to bring it out. A little bit about medications. There are 2 types. Short-acting and long-acting forms exist in both types. There are the amphetamines, things like Vyvanse and Adderall, and then the methylphenidates, Concerta, Ritalin, Metadate. If those don't work, meds that are used less often are Strattera or Clonidine. But these are the 2 types of medicines, and it's equal. Some kids respond to one, some to other. I really don't feel that one is better than the other. And behavior modification. I am of the camp that you need some behavior modification, okay? Behavior breaks down when the demand placed on a person exceeds their ability to complete the task. If you ask an ADHD kid to put on their coat, get their hat, and get their homework, okay, you've exceeded their ability to complete the task. They can't do it. Behavior breaks down, mommy gets mad, you have a meltdown before school even starts. So you have to learn how to work with your ADHD child. You do want your child to develop the skills to master life, meaning you can't just coddle them and do everything for them because they're going to go to college and they need to know how to handle life. So learned helplessness can be a result of not taking the time to teach your child with ADHD how to master life. Message is, pills don't teach skills, and pills can be helpful. So what can you do as a parent? You want to pick a few areas to address. You're not going to reshape and change your whole child. Pick a couple of areas. Maybe it's homework, maybe it's helping with chores, maybe it's getting ready for school, whatever it is. Pick a few areas, discuss it with your child, and set clear boundaries, and have the discussion when your child is not upset. So on a Saturday afternoon, talk about what your expectations are when there's no upset. No child or adult can learn when they're in the experience of upset. You can't take in new information because you're crying and angry or whatever it is. In a calm way, discuss what you want, and then when there are problems, key part here, remain neutral when there are violations and simply institute the consequences. Oh, I see you didn't take out the trash, and so we have an agreement that when the trash isn't taken out, there'll be no screens for the rest. No screens means no TV, no laptop, no iPad, blah, 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 for the rest of the evening. Done. You don't have to say, I've told you 1,000 times. You don't have to say, when are you going to learn? You don't have to do any of that stuff. It's just remain neutral and institute the consequence. And love your child. This is your child, a really beautiful, beautiful being who doesn't know any better. and growth takes place in a loving environment. So with all of this chaos going on, bring your heart in and deliver your consequences with neutrality. And I think that's the most important part of this talk, is that we need to love our children, even when they're not behaving the way we would like them to behave. It's not their fault, and they'll grow with neutrality and clear consequences and love. Tips. Okay, use a timer. All right, you got to clean up your room. Last time it took you 8 minutes to clean up your room. Let's see if we can do it in 5.5. All right, go. Boom, 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 boom. Now you've got that prefrontal cortex engaged because it's fun and it's interesting, and you got them moving. Already talked about one instruction at a time. That's really important. Frequent praise. You got to look for the things that they do well. It can be the stupidest thing, but, oh, thank you for putting your dishes in the dishwasher. Oh, you already have your coat on. Whatever. They say that a praise ratio of 3 praises to 1 consequence or 1 negative comment is really necessary for a child. And I agree with that. People learn by praise. Charts are helpful. Rewards to stimulate the brain. Give choices. Would you like to mow the lawn on Saturday morning or on Sunday morning? You're mowing the lawn, but you have an option. That gives a child a bit of power. Reminders and support. Again, be creative with all of this stuff, and back to be patient. Other points. Things can look normal on the outside for adults and for kids, and inside there can be a lot of turmoil. Keep your cool. When there's a problem, don't raise your voice, don't point. I know we all want to do that, and we do it every once in a while, and that happens because adults are humans too. Kids don't believe we're human, but we're human. But as much as possible, stay cool. And ADHD kids are needy. They really are needy. They need us. They need us a lot, and they want us. And get help for yourself if you need it. If you think you may have ADD or ADHD, Ellen's going to talk about how to handle that. Help yourself to help your child. Or join a parent support group so you can go over coffee and then talk about, oh my God, my kid, da 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 da, and get support. Take-home message seems to be the same again. Be patient and stay calm, and remember your love for your child. And then I have resources of books and websites at the end. So that's a quick and dirty on ADHD and kids. Any questions? Let's turn the lights on a little bit here. Yeah.
In the last section you just went over, could you talk about some of the consequences of raised voices and pointing, because that's a common theme in the house?
Yeah. What happens when a human being has a lot of energy coming at them, a lot of loud voice, or whether it's a fist or a finger or whatever, the natural reaction is to get afraid. Okay? So we naturally go into that fight, flight, freeze reaction. It's like, oh my God, I'm scared, something's coming at me, and we contract, we protect ourselves, and then we can't take in the things that we need to learn. Because our effort goes into managing being afraid instead of managing the new information that we're supposed to be learning. That's why the finger pointing and the raised voices. It has a place, okay? Your kid runs into the street and there's a car coming, you're gonna flip your lid, and that's what happens. But if the socks aren't picked up and there's a big adult temper tantrum about the not picked up socks, the child's just going to learn to be afraid instead of learning ways to cope.
And the next statement about judging. Can
Yes.
you give an example that would kind of motivate, judging, that sort of thing? Is it along the lines of, you're doing this, but your brother doesn't do this, that sort of thing?
Well, yeah, at any point in time, in comparison between kids is really painful.
Yeah.
That's just, because kids are individuals and humans, and I suspect you don't want to be judged with your neighbor for how your neighbor drives the car and mows the lawn, does whatever. Same thing with kids. They do not want to be compared. It's easy to do. We've all done it. I've done it. I've got 2 stepdaughters, and one is this way and one is, why can't you be like da. We all do it. So we're human, but it's not the best way to address the situation.
Okay, I know in the little booklet I picked up, I think it's National Institute of Mental Health, it says that bipolar disorder can coexist with ADHD. And I know about a year ago, there was an article in the New York Times how difficult it is
Yes.
to diagnose bipolar in a child.
Yes.
So is there any such generalization? Generally what happens is this maybe like the child has attention deficit and then is approaching adulthood, that bipolar becomes grossly obvious. Is that usually what happens or no?
The diagnosis of bipolar disorder in a child is still a work in process.
Oh,
Okay.
yeah.
Right now, our criteria for bipolar disorder are basically based on adult behaviors.
Yes.
And we are extrapolating from adult behaviors to a child. Okay, but the way a bipolar adult acts at age 35 is going to be different from the way a bipolar child acts at age 13. So we're still kind of sorting that one out, even just how to diagnose bipolar in kids, let alone diagnosing 2 conditions. So with that one, I would say go slow, take it carefully, calm down, and look at what the major symptoms are and understand the child.
It's so hard, and the same with the medication, like, I know they're doing a whole lot on DNA and stuff like that, and I think that's where it's gonna head with this. That you're gonna be able to do some kind of test to see which medication would be proper for you. Because they don't know, and they go through all these trials, and they can have all kinds of bad side effects.
There are lots of side effects. That's one thing I didn't talk about. The medicines can make you active, so it's hard to fall asleep sometimes. Some kids don't grow as well. They don't eat as much. It is a work in process.
But on the other hand, if you don't give the kid, the child medication, and they can't function in school, you've got another set.
Absolutely.
I know,
Trial and
I
error.
know.
It is real trial and error. I'm going to take one more question. In the back, you had a question. Yeah.
Yeah, I'm concerned about developing addiction to amphetamines. Like
Right.
my son is 18, he just turns 18 this week. So I'm thinking about taking him to a doctor and get medication, but
Mhm.
he develops substance abuse. And the other thing is that over time, would patients need to increase the dose, or is there a time where they can just stop and be fine?
Right. Okay. I think I'll answer your questions in backwards order. Some people outgrow their medicines and do not take them for the rest of their life, and some people don't. It really varies on the individual person. Ellen is going to talk a lot about adult ADD and the ways to manage that. And one of the things that I believe in a lot is coaching. There are coaches who teach adults how to manage their ADD. That may be a substitute for medicine. It may be an addition to medicine. Okay, but as an adult, you can learn to organize things, to color code your file system, to have clear boxes so you can see, oh, socks are in this box and underwear is in that box, and how you make life manageable with ADD, because you can manage life with ADD. So you can outgrow it with help. I think without help, you're kind of floundering on your own, and it's like anything else. If I don't receive help in learning how to fix my car, the chances of me figuring out how to do it on my own are pretty nil. So we need help to learn things. That's part of being a human being. So as an ADD adult, getting outside help is really beneficial. In terms of the addiction question, there are people who overuse Adderall, for sure. Okay, Adderall is a combination of norepinephrine and dopamine. Norepinephrine gets you all revved up and da-da-da-da-da. That's what brings your brain online. Dopamine is part of, too much dopamine can stimulate the pleasure centers and can lead to addictions, like you said.
But that doesn't happen anywhere near as much in ADHD.
No, it doesn't. No, it doesn't. You just don't want to be, you need to find the right amount of medicine. That's why you need to talk with different people. You need to talk with the patient and the family members and school teachers and get signed releases so that you can talk with everybody and see how the person behaves with and without medicine. And there are guidelines. Okay, you're not allowed to prescribe more than a certain amount of medicine. But in general, the kids who have ADHD and are on medicine have less issues with addictions. Okay, medicine is preventative. Stimulant medicine is preventative against addictions. Okay, it's the kids who are not medicated who end up with substance abuse problems because their lives out of control, and so they use the medicine to calm themselves down or manage, and they do it inappropriately, and it becomes illegal. And And one more question. I'm sorry, you had your hand up as well.
Do you see? Well, I was going to ask you about the medicines too, but they're like Ritalin.
Yes.
That had kind of a bad rep, and kids didn't want to take it because they said it was going to be too short, and this and that, and the other did stomach their growth. We heard that also. People said that.
Right.
Is there any indication of ADHD or ADD in the sleep patterns, other than the behavior patterns?
Right.
Are there any other physical symptoms that you can point to, especially in the area of sleep?
Right. Right.
I mean, you're saying after they're medicated, this could go wrong with their sleep, but does something happen with sleep? And are there kids, second part of the question, are there kids who are lethargic, they're not moving as quickly? So on the one end of the spectrum, you have the kid that's moving around. And on the other end of the spectrum, you have the kid who's not moving as fast as anybody else. Now, is that ADHD?
That's a real complicated question because, about this many things can make you not move fast. I will say the inattentive form is the child who kind of daydreams and looks out the window. The teacher calls home and says, well, Johnny's just not interested in math. He's always staring out the window. Well, then you ask her, and it's, he does great in history class because he loves African history, for example. But when it comes to math and science, he's bored and he's gone. That's the inattentive form of ADD.
The answer is yes.
Yes. Oh, absolutely. Yes, ADD can make you just kind of sit there and not want to do anything. It's like, they're daydreaming. They're off thinking about something that's more interesting than what's going on in the moment. In terms of actual sleep patterns for kids diagnosed with ADD or ADHD, I don't really know the answer to that. That's not something I've studied. I can tell you that kids with ADHD, they need to run and play and jump and go to the playground. Winter is hard on kids with ADHD because it's bad weather and they can't get outside. If you get these kids outside running for an hour a day, they're going to sleep better at the end of the day.
Yeah. Adults have a lot of trouble with that because once you start hyper-focusing on something, if you can't stop and no one's making you go to bed, you may get very strange sleep patterns.
Yes. Okay. I think we will bring this to a close.